Dear friends, very commonly the patients who come to visit my clinic complain of gases. By gases, they mean either excessive burping and belching or passing gas as a flatulence through the rectum. The air that we swallow is generally thrown out or expelled as belching. But if that passes through the stomach to the intestines and it is joined by the gases which are created by digestive process, then all this gas is then expelled as flatulence or flatus. Flatulence is gas that is passed through rectum. Now it is very common and normal that body digestive process forms gases. Even normally also, every average man or woman passes gas at least 8 to 15 times even without knowing it. But excessive flatulence, though most of the times it is normal, sometimes may mean an underlying gastrointestinal disorder. In today's video, we are going to talk about flatulence, its causes, and how to manage it or minimize it. I am Dr. Prasad Honap, a consulting physician, and you are watching Let's Talk About Wellness. Flatulence, commonly known as passing gas, is the release of air or gas from the digestive system through rectum. It is a normal bodily function and can happen multiple times, I have just told you. Now, what are the causes of flatulence? Most of the air that we pass is the air that we swallow when we are eating or drinking. We swallow air when we are anxious. We also swallow air when we are smoking. Consuming gas producing foods such as beans, broccoli, cabbage, onions can produce a lot of gas during the digestive process. People who are intolerant to dairy products, that means those who have lactose intolerance or other food intolerances, can have excessive gas formation. Digestive system disorders such as irritable bowel syndrome or IBS, we just had a video on that subject, or inflammatory bowel disease also can have excessive gas formation. Now, what are the major contributors to abdominal gas? For example, beans. Beans are notorious for causing gas due to their high fiber content and complex sugars. The human body has trouble breaking down these sugars, leading to increased gas production. Second is broccoli. Broccoli is a cruciferous vegetable that contains a substance called raffinose. This is a sugar that is difficult for body to break down. As a result, it can cause gas formation and bloating. Cabbage, like broccoli, is also a cruciferous vegetable and contains raffinose. It can also cause gas formation and bloating. Fruits such as raisins and prunes, or apples, apricots, peach and pears can cause excessive gas formation. Dairy products, especially those who have lactose intolerance, can contribute to flatulence. And food with high fiber content such as seeds or husks also contribute to flatulence. Now, when is the flatulence abnormal? Which means if you have flatulence, you should go and see a doctor. Flatulence is a normal bodily function that occurs when gas is released from the digestive system. However, when flatulence is associated with other symptoms such as persistent or excessive flatulence lasting for more than few days, when flatulence is excessive and foul smelling, when flatulence is accompanied by other symptoms such as abdominal pain, bloating, diarrhea or constipation or rectal bleeding, and if the flatulence is interfering with daily activities or quality of life, then you must seek medical advice. How can we minimize flatulence? Flatulence, though normal, is at times embarrassing, and the tips that I am going to tell you would help you to minimize the amount of gas that you have to pass. First and most important is some dietary changes that you should make. One of the most effective ways is to make dietary changes. Avoiding gas producing foods such as beans, broccoli, cabbage can be helpful. Additionally, eating smaller, frequent meals can help to reduce the amount of gas produced in the digestive system. Remember, if you are hungry, you tend to swallow more air. Those who have lactose intolerance should avoid or limit dairy consumption. Avoid foods containing artificial sweeteners such as sorbitol or mannitol. These foods are found in candies, chewing gum, sugar-free diabetic-friendly foods. Second lifestyle change is exercise. Regular exercise can help improve digestion and reduce flatulence. Even a short walk after a meal can be beneficial in minimizing gas production. Please remember, our parents used to do what is known as shatapavali after dinner. Excessive use of laxatives should be avoided. Smoking contributes to flatulence because every time a person smokes, he sucks in air. People who have problem with smelly flatulence can use charcoal pads or also charcoal tablets, which generally absorb the gas and deodorize the flatulence. Friends, flatulence is rather an embarrassing inconvenience. I am sure these tips will help you to avoid such embarrassing situations. Thank you very much.